Hello, everybody. This is Dr. Aileen Tanafranca. I'll be presenting to you our series of Ask a Nurse. So this month in November, we're going to talk about understanding diabetes. It's prepared by Leolinda Mangawan, one of our nurse educators, and our dietary manager, Paige Giordano. So a little bit about diabetes. Basically, it's a disorder in which the body does not produce enough or respond normally to insulin, causing blood sugar or glucose levels to be abnormally high. Signs and symptoms of diabetes includes frequent urination, excessive thirst, unexplained weight loss, extreme hunger, sudden vision changes, tingling or numbness on the hands and feet, and feeling very tired much of the time and very dry skin. So there are three types of diabetes. Type 1 diabetes is thought to be caused by an autoimmune reaction. There's type 2 diabetes and gestational diabetes. So what is the main cause of diabetes? So although not everyone with type 2 diabetes is overweight, obesity and inactive lifestyle are two of the most common causes of type 2 diabetes. These things are responsible for about 90 to 95% of diabetes cases in the United States. So how do you fix diabetes? So there's no known cure for type 2 diabetes, but it can be controlled. And in some causes or cases, it goes into remission. For some people, a diabetes healthy lifestyle is enough to control their blood sugar levels. So how do you manage diabetes? What to do? Talk to your doctor about an exercise plan. Ask your doctor about what type of exercise is appropriate for you. Keep an exercise schedule. Know your numbers, know your blood sugar levels, right? You got to check your blood sugar levels, stay hydrated, be prepared, and adjust your diabetes treatment plan as needed. So diabetes, there's 4 food choices that greatly increase your diabetes risk. Highly processed carbohydrates, sugar-sweetened drinks, saturated and trans fat, red and processed meats. So what are carbohydrates? So carbohydrates are found in many different foods like vegetables, fruits, starches like bread, pasta, rice, and dairy. Carbohydrates are also found in healthy foods and not so healthy foods, and they both can increase your blood sugars. So even when we're eating vegetables or fruits with carbohydrates such as bananas or potatoes, we should be having appropriate portion sizes. And the best method is to give yourself a portion the size of your fist when making your meals. So the best diet for those living with diabetes, a well-balanced diet that includes all of the food groups, right? Like fruits, vegetables, whole grains, lean meats, low-fat dairy. You want to limit or avoid highly processed carbohydrates like cake, cookies, fries, chips, candy, sugar and sweetened drinks like soda, sweet water, fruit punch. And it's not about what you cannot eat. It is all about portion control. So this is the plate planner for portion control, right? So when you're eating your plate and planning your meals, use my plate planner. Half of your plate should have low starch vegetables. A quarter of your plate should have high starch foods. Okay, this is where you can use your fist to estimate your portion, okay? And a quarter of your plate should be lean meats like chicken without skin, fish, lean steak. So there are sweet alternatives for those living with diabetes, or if you want to control your blood sugar, right? When you get a sugar craving, reach for these foods instead, right? Like sugar-free unsweetened beverages such as unsweetened tea. There's many good brands out there now with really good flavored tea that are with no sugar in it. You want to mix half a cup, 100% fruit juice with seltzer or club soda. Okay, a cup of fruit like berries and melon, a quarter of unsweetened dried fruit, plain yogurt with blueberries, apple with peanut butter, a quarter cup of trail mix, sugar-free jello or pudding, and dark chocolate. So there are 10 breakfast foods for people with diabetes, right? So eggs, great, Greek yogurt with berries, overnight chia seed pudding, oatmeal, multigrain avocado toast, low-carb smoothies, wheat grain cereal, cottage cheese, fruit, and nut bowl. Those are very good alternatives. So what vegetables should diabetics limit? Okay, so canned vegetable with lots of added salt should be limited. Okay, veggies cooked with lots of added butter, cheese, or sauce. I know we love all those sauces, but we gotta limit it. Pickles, if you need to limit salt, otherwise pickles are okay. Okay, sauerkraut for the same reason as pickles. Limit them if you have high blood pressure. So how do you feel when your blood sugar is too high? You have increased thirst, like I mentioned before, frequent urination, fatigue, you're tired, nausea and vomiting, okay, shortness of breath, stomach pain, fruity breath odor, a very dry mouth. Okay, and what else other things you can do, right? So most people will feel the effects and symptoms of low blood sugar when blood sugar levels are lower than 50. Okay, so you do check your blood sugar. You can have nervousness, dizziness, trembling, sweating, hunger, weakness, and palpitations, right? You feel like your heart is racing. So here are some of our references. Take a look at those sites if you're interested. And thank you for watching Ask a Nurse web series. Stay tuned for us in December for more of our content. So please place the comments below and click like on the section so we can get some feedback. Thank you and have a good day.